A nation ignored. The urgent need for heatwave preparedness in the UK. The UK is facing a simmering crisis, one that's not erupting in fiery volcanoes or devastating floods, but in the seemingly innocuous rise of summer temperatures. A recent study published in Energy Research and Social Science paints a stark picture. The nation is woefully unprepared for the escalating threat of extreme heat waves, a threat exacerbated by climate change and a shocking lack of governmental action. The 2022 heat waves, reaching unprecedented temperatures exceeding 40 degrees C for the first time in UK history, served as a brutal wake-up call. These extreme weather events, driven by relentless fossil fuel consumption, are no longer anomalies. They are the grim new normal. The consequences are devastating. Data from the UK Health Security Agency reveals over 10,000 heatwave-related deaths between 2020 and 2024, a chilling testament to our collective failure to adapt. The study, surveying nearly 1,600 households, unearthed alarming statistics. Half reported disrupted sleep due to excessive heat, while a quarter suffered frequent headaches, fatigue, and reduced work productivity. Perhaps most alarmingly, half of respondents admitted to having little to no knowledge of effective heatwave coping strategies. A separate study amplifies this concern, revealing that a third of the population still doesn't perceive heatwaves as an imminent threat, a staggering level of unawareness in the face of mounting evidence. This ignorance isn't accidental. It's the product of systemic inaction. The study's authors condemn successive governments for their lack of serious engagement with this growing crisis. The 2023 UK Climate Adaptation Plan, released under the previous Conservative administration, is criticized as hopelessly inadequate in addressing the rising threat of heatwaves. One researcher poignantly recounts a conversation with a policymaker who dismissed the issue with a dismissive, "We only have 1 month of summer. Why do we need to focus on that when we have 11 months of cold weather?" This callous disregard highlights the deep-seated disconnect between policy and the escalating reality on the ground. The study further underscores the disproportionate impact of extreme heat on vulnerable populations. The 7-fold increase in air conditioning usage between 2011 and 2022, reaching 21% of homes, signals a desperate attempt to cope, but this trend is unsustainable. The increased strain on the national electricity grid, the surge in carbon emissions, and the widening social disparity, leaving low-income families unable to afford cooling, are all unavoidable consequences of this reactive, rather than proactive, approach. The UK's high rate of heat-related deaths in 2022, among the highest in Europe, serves as a stark warning. We're not merely facing an inconvenience, we're facing a public health emergency. The simple coping mechanisms adopted by many, lighter clothing, cold drinks, and cool showers, offer limited protection against extreme temperatures. The lack of awareness coupled with inadequate infrastructure creates a perfect storm of vulnerability. This is not simply about installing air conditioning. It's about a fundamental shift in our understanding of and response to heat waves. It requires a comprehensive, multi-pronged strategy. Improved public education campaigns to raise awareness of heat-related risks and effective coping strategies. Investment in sustainable cooling solutions that minimize environmental impact, and robust social safety nets to ensure that vulnerable populations are protected. The time for complacency is over. The rising temperatures are a stark reminder that climate change is not a distant threat. It's here, it's impacting lives, and it demands immediate and decisive action. Ignoring this crisis will only lead to more suffering, more deaths, and a heavier burden on future generations. The urgent need for a national heatwave preparedness strategy is not a matter of debate. It is a matter of survival. Let's demand that our leaders act before the consequences become even more catastrophic. The future of our nation's health and well-being hangs in the balance.